functionality of the scope. Do you want to go over that with
Yeah, I
them?
can do that.
Like how the doctor uses
But
it
we
in
can
the
join in,
procedure.
but-
Because I can go over what we're testing, the cleanliness,
Yeah.
but I think they just want to know the.
Yeah.
All right, so this is a duodenal scope that we use on all our ERCPs. To start off, like any other scope, these three are the same. The suction and these two are for suction and water.
This is
rinse,
water.
Water rinse and stuff. This is our biopsy port.
Instrument
We
biopsy port.
put instruments through, not just biopsies, brushing, whatever doctors want to do, we do it through here. And those, we're using this, disposable ones, one-time use.
So now the caps are not washable like they may be at one point. Now we're using all disposable caps, right?
Yes.
Okay.
So going down, this is the end that's different than like an EGD scope. It's a little bit thicker than an EGD scope. It has an elevator. When you bend it down, it helps them to go in and out into the area where they want to examine.
And usually
So-
they go into the biliary
common bile
duct or the
You want me to open it a bit
gallbladder.
closer?
So this is the area where we're worried about the bacteria and all that.
The back of the-
Don't stay there, yeah. So careful brushing, lift it up, the same thing. This is the area that's concerning how it gets clean. Other than that,
Yeah.
that's
Yeah.
the part that we do, yeah. Most of it, the rest is like our other scopes, just this part.
And then
And-
what we, oh, go
Like,
ahead.
sorry, this is the older model. This one has, what do you call it, auxiliary?
Elevator.
Auxiliary
We call it an
water.
elevated guide wire.
Yeah,
Yeah,
water
whatever
jet.
you want to call it.
But this also has to get tested, I know, but
When you guys clean the scope,
Yeah.
you,
We
you
flush.
flush that.
like 5-10 cc safe, because if you didn't, once you flush it, I've seen
Yeah.
it,
The
bile
bile.
comes out. If you didn't flush it, you'll have that
Yeah,
stain
so the
there.
bile will
Hmm.
stay
So
trapped in
this is
there.
Can I
part of
tell
the
you
very
the-
important.
Can I tell you a story? When we have done the testing,
Yeah.
people didn't know that they were supposed to flush that out.
Wow.
And a
Some
lot of
hospitals.
times, because you have to leave this all free, not, what do you call it, on a break mode. So this is free, so sometimes people may not see this. So for us to be able to access, you gotta do that,
Push
but then
back.
don't forget to free the,
back.
yeah, so this is for you access to clean.
So to
Yes.
recap, there's a total of 4 ports that get flushed during the cleaning.
During the cleaning, this one is the flushing,
Mm-hmm.
this one is where you do brushing and suction, whatever you can. And there's 2 areas here where you put a brush.
So you're flushing
Straight
the-
through, comes out right here. You angle it down, will come out through here.
Two brushes. That's
The
a flushing.
the
right?
same brush, but
Same
it goes
brush.
in 2 different areas.
Okay.
Yeah, so for our purposes, what we do is we can show you how we're gonna test it, but, that elevator channel is the main culprit that we wanna make sure that we test properly, but, and I think you covered
Yeah,
Yeah. she
Most
covered
of
most
it.
this is the extra. This is where the suction fluids from the patient. It's attached to a canister. Suction
So the
fluid.
biggest problem is, you have a small tube and then another tube like through the instrument port to go into the biliary or the gallbladder tract to remove. What do they mainly do the ERCP
For the
procedure for?
Uh,
Is it like cancer or blockage
It could be
or?
both. If they have a stricture, they may have a stricture where it's cancer, or it's blocked because of stones.
So did they remove the
So
stone?
we'll go in there, cut the ampoule a little bit and remove stones out of the balloon.
Or a stent extraction.
Or
Stent so they'll
if
put
you
a
need to
stent.
put a stent for a stricture, then you put a stent. Yeah.
And that's a more complicated
It is
procedure.
more
So
complicated once you have.
some of your GI docs don't do this procedure, or do all of
Only the
them?
GI.
We have
exams.
2 doctors, one is finishing training, one is fully trained. At all of you that are doing this.
All of them
Here.
are doing it?
Two
Okay.
of them.
Just 2.
2 of them. How many GI docs do
We
you
have
have?
4 attendants, 2 part-timers.
Because usually there's always 1 or 2 of them that are specially trained to do this procedure, so. Is there any other questions that you have? Okay. So then, what we do is they'll do the bedside clean. They'll wipe it down at the bedside, flush it, bring it. You'll do the leak test, and then they'll do the manual clean. Correct? In your scope techs, do you guys clean? Do the
Right
nurses
now,
clean
we
or do
are.
the scope techs?
No, we
Okay.
Until we get the text.
Until we get text, yeah.
All right.
It's coming soon.
So then, what we do, our procedure is. Oh, would you open those plugs up?
Open the plug.
You have big enough for that?
What?
Is that a big enough area for you?
Sure.
Yeah, okay.
So what?
The other one like this?
I was gonna put it in.
Anybody got scissors on them?
You want scissors?
Scissors?
I got.
I just,
Oh, you're right, you're right.
just don't wanna make a mess of the bag.
So it's 40 cc's.
Regular water? It's got kind of-
Still water?
Sterile water. And the reason we use sterile, you know why? Because, just city water contains contaminants or coliform. Oh, sorry.
It's a wrong week.
Oh.
Oh.
Thank you.
So if we were just to test city water, the colony forming units that we're measuring can kind of jump around just in city water. So that's why we use the sterile water, so we have a flat baseline. So then you'll need your 60 cc syringe. These, when you order the water swabs, come with, they're a no charge item. So you get 100 of these, because after the procedure, you're throwing these away, right?
Yes.
So that's why you want these. These, what we call them are just plugs. Real technical. Okay. So what do you think we plug? So we plug any ports where water's gonna come shooting out if we try to flush it. So we plug the suction, and don't just ram it in there, just kind of push it in there snug. And then we do the instrument port, okay? And then this, oh, they put the cap on. No, I'm up here. Right up here, the suction. So after it comes out of the sink, you'll flush it with, you'll just inject it with 60 cc's of air. And the reason is to get any of the residual fluid that may be left. And then, did you bring your stand?
Yeah, it's right there.
Okay.
That stand is designed for those larger medicine cups. Might need the scissors again, that thing's pretty hard to open. Oh, you got it.
Well,
I'm just weak.
you can do it with this stand, or
Smell good?
let's just do it to the way.
This yours is stand now. Last year I didn't have the stand.
No, we have something else.
Do you
It's
like this?
something else.
Do you
I
like?
it? Yeah. But it's a
Well,
stand.
maybe if you're.
I'm going to show you
one person
both ways.
in there, you
can
need
see
somebody
it
to
on
hold
the-
them.
Before.
Remember?
Yeah. it was
So
kind
then
of
you'll
hard
drop
last year.
40 cc's. And try not to shoot it on you. Thought I got pretty close to it. And then I just try to use the same cup. So normally I would have something to pour this into, but pour it into this thing. And then I'll just use that. And normally I would have gloves on. And so we just connect it there. And then, so what's nice about this is you can use this hand to hold it. Now, if you didn't plug the suction, you'd have to, you know how you have to manually depress, and which this you don't have to. So you just flush that through. And then you're wondering, where is all the water?
There.
It's still in the, it's a 6-foot tube, right? So then
Air over
you,
here.
the beauty of air, right? Okay, and that's all there is to it. So then you take your swab, which will do the surface swab.
Are they different than the other ones? They're the same.
These are the same.
Okay.
Now, is this happening after high-level disinfection?
Before.
No, before.
Okay.
And that is a
Clear.
great question. Why do you think we do it before high level?
Yeah, we washed it.
Yeah.
You can't disinfect dirt, right?
Yeah.
So if you don't remove the organic material, doesn't matter high level, steam, whatever it won't. So then, what am I doing? We're gonna, so these are the water swabs, and you can tell it's a UK program. You'd think the blue would be water, right?
Mm-hmm.
But it's just the opposite, so. These, when you open them, they have a shelf life. So when does that expire?
2018, February.
Okay. Usually it's about 10 months from when you get them. But after you open them, you take them out of the fridge at room temp. The water swabs are good for 7 days, and the surface are good for 21. Okay,
So do you have to put it back in the refrigerator after you use it? After you open it?
great question. Yes, we recommend that. But if you forget, it's not a big deal. It's just gonna help preserve it. So just write on there with
The open
a little marker that I opened it on such and such a day.
Okay, so 7 days.
Now, what we would do first is, you guys are gonna use the LX25. Are you gonna be one of the ones? All right, so let's let you do this. All right, so I'll have you powered on. Just hold it. You may wanna just kind of hold it for about 2-3 seconds. All right, and you should be able to let it up. Or is it already on? So go ahead and hit the up arrow.
Who's gonna be ordering this device?
Hold it down.
Like the
for-
swab?
There you go. That's, it went into the sleep mode. But normally what you'll do is it'll power up and it'll run a diagnostic. And then your login, did we put in your,
I'm Ortega.
do you recognize any of these names?
Moreno.
Okay.
Oh, right there.
Is that you? But have you logged into the system?
At
Did you get the
one
welcome
point,
letter?
like a year ago.
No, you would have been like 2 weeks ago, like 1 or
Oh,
2
no.
weeks ago. Did they send you a welcome letter? To go on the website and make your password and everything? We'll have to look at that. So we're gonna do mine now. Okay, so why don't you find your scope? So do I do scope? And
6714.
see how that's easy, it's just kind of a touch screen, so then just hit manual clean. And then what that'll tell you, the scope serial number, manual clean. And then if you want to capture the technician, you can do the drop down arrow. Are we gonna,
Oh, just keep that one.
are these, I'm gonna cancel that and let you
Okay.
pick it. Okay, and then perform the audit. So then, those are the test points. So we're gonna go out of order, but let's test We just did the suction biopsy.
Oh, so this one?
Yeah.
Yeah, so if you wanna. All right, and then just wait a second. Okay, so then it has a, and if you want, you can just set it down. It has a honeycomb. So you'll dip it to, you want it to the tapered end. Sometimes I hold it just a little bit of an angle and I just count 1, 2, 3 and bring it up. Don't do this, because then you're gonna get rid of all the water. Okay? So you just straight down, straight up. Here.
Punch it in.
And then push that down as hard as you can. It's gonna come in contact with that solution. And then what we call is just the shake and bake. You can do this for about 10 to 15 seconds. And you go ahead and open that, pop it in there.
Oh, you have to hold it open?
Yep, you can just let it go now.
That's it.
And then just hit begin measurement. And then, so what's the value that we want?
Under
Below.
100?
Yeah, below, is it 200?
Ours is 200.
Oh, 200, okay, we have more,
Good job,
more,
guys.
more.
More. So 12.
Nice,
Do we expect those values to be low?
yeah.
Because it's already gone through the high level, right? So then, to take it out, and just pop that out. And then you hit return. And then let's do the elevator guide wire.
So you don't hit done until you're all done with all four,
There's
Right.
4 channels that you
Yeah,
have
you
to
won't,
test.
you just hit done.
when you're done with all 4 of them?
And
Okay.
maybe you're only gonna test
Two.
2 or 3 of them.
Oh, okay.
Like the elevator and the water channel. Well, that's it.
The most important 3 to
3
test.
actually.
We recommend 4, but is the guide wire,
Actually.
the
Guider, that's not a guide.
the inner lumen flush,
It's water.
and then the elevator. So with this, and you can either hold this or you can set it down. And so we're gonna swab here. We're just gonna roll it.
Okay.
We're gonna bring that up. We're gonna go underneath here. And always bring this back, because if you flush it after, it's gonna go squirting this way. Okay?
Okay.
So then we put it back in here. Press it down. Shake and bake. About 10 to 15 seconds. Okay? And we did that. All right. And
So
then
you're
we'll
clicking on what you're testing?
What is
go ahead and put it in.
It's the same thing.
That's
And then
That's the
begin
same thing.
measurement.
That's like
yeah.
a dry testing, but
Yeah.
the other one was wet.
So this is the surface swab.
That's your surface.
So it's a dry
Yeah.
area. It's 133. Okay? So we just hit return.
We've been touching it also.
Can you pass?
Below
With the other one, I will be washing it again.
Is it 200 for the scopes or 250?
200.
200? Okay.
Hold on, why didn't that show up? Did we hit the wrong one?
Maybe you hit the.
All right. You just have to make sure we hit the right.
The right testing.
I think we left it on the same one. Now it shows.
Suction.
Yeah. So then let's do the,
That's surface.
so let's do the elevated guide wire. So how in God's name do we do that?
Do you have another little cup or something?
There's another.
Yeah, we'll just use this same
Okay,
one.
same,
Oh,
okay.
Now, we don't have an adapter for this, so how do you flush?
Oh, we have an adapter.
Can you get it?
Do you want me? Okay.